My job involves the reporting of trauma x-rays that we get in through A&E. It's been shown we get through tens of thousands of reports a year. I still do a lot of clinical work around the department. It's a nice change of pace, you're not doing the same thing all day, so it keeps the job interesting really, which is fun.
I started as a band 5 radiographer, just working in the main x-ray department, and then the opportunity came up for nuclear medicine and it was what I wanted to do, so I jumped on it straight away.
Every day is different, every hour is different. So you could be working at 1 minute here, then you'll be up on the ward, down in ICU, around in resource. Cover the whole of the hospital, so that includes neonatal, outpatient clinics and also intensive care portables. Working with a lot of trauma. We also have a separate resource room where we do separate trauma series there. Other than that, it's in the main department, so fracture clinic follow-ups, GP referrals. We also rotate through theatre radiographers.
This camera here, we do bone scans, renograms, cystograms, melanomas, so if we're looking for sentinel nodes.
There is no 9 to 5 really, because I split my time between fluoroscopy and general as well. So some days I'm in here 8:30 till 4:30, and then the rest of my day will be in general because we work long shifts, so I work till 8 o'clock at night often. So in here we tend to do a lot of barium swallows, we do ERCP, we do myelograms, lots of different things.
September just gone, I started at Salford University, so it's 3 days a month at university, 3 days a week in this department in nuclear medicine, and I still do 2 days upstairs in the main department just to keep my hand in.
I'm actually back at university again. I'm training to because we report on GP examinations as well, so I'm training to do the reporting on that. It's a slightly different style.
So I'm a trainee advanced practitioner now. That means that I go to the University of Salford at the moment training how to do barium swallows. So I've got the university side of things as well as my practical side of things to do as well, so I've got a bit going on at the moment.
This is my training hospital when I was from university, and I was fortunate enough to carry on and get my employment here, so I am probably a bit biased and protective of it, but yeah, there is fantastic opportunities here.
The size of the hospital, even though it's an older hospital, it's got the specialties and there's a lot of development going into the specialties that are here. So it was good from that perspective.
I wasn't expecting anywhere near the amount of support that I did get, to be honest. Yeah, it's going really, really well at the moment, so I'm chuffed to bits, really.
There is different areas as band 5 level when you first qualify. So I'm now a super user of the digital rooms, did the secondment impacts, that's my personal choice. I am trying to get on to where we're looking at introducing a link role into CT where I'll become more specialised in CT, so that's my kind of ideal job.
We like to encourage staff to come and do reporting sessions as well, because it's an area that a lot of them are very interested in. Because if nothing else, it gives them an added appreciation of how they do their job. It shows why we need to do things the way we do them, what the benefits of good practice is really, so it just adds that bit of emphasis to it.
You're encouraged to be a really good radiographer, and with all the opportunities really, you couldn't wish for a better place.
If there was any other problems, you wouldn't feel worried about anything. Everybody's there to support you, they're really helpful.
Everyone's friendly. That is one thing I did find here at Preston, is when I started, people were very friendly, they were very keen to talk to you, find out who you were, where you came from.
Couldn't ask for a better workforce whatsoever. Sometimes you don't bring your personal problems to work, but sometimes it's inevitable that life's life, and I personally have been through a difficult time where all I want to do is come and work with these guys because it's such a fab team.
Overall, the majority of people who come here always do pass comment that that the staff are a really good crowd to work with.
The staff are really supportive and they've given me a lot of time, so if we've got a spare hour or so, they've allowed me to go to the library to do some of my work. And management are really supportive as well, like our manager Caroline Mee, she's always asking me, are you okay, is there anything we can do to help? She's been really helpful with me, so I couldn't have asked for any more really.
They're always encouraging you to progress. You have your one-to-ones, your meetings, your appraisals, where you can specifically say what areas you want to, but they're always encourage you to progress and basically to become better.
They're always making sure that everything's running as smoothly as it can be.
Preston's a tertiary referral centre for a lot of specialties, so there's a lot of interesting patients that come through. And we've got a big cancer centre here at Preston. It's the Rosemere Suite just down the road.
The fact that we're a major trauma centre is a big drawing point because obviously that's a big chunk of it. We've got a lot of other specialties, like we're a big vascular centre. Obviously we've got a huge theatre, we've got massive neuro centre as well. So we've got all specialties, we do a lot of fluoroscopy and interventional work, that sort of thing.
I think it's a brilliant place to work. There is a lot of career opportunities. I mean, I've been here just over 2 years and I've already progressed into this new role. There's always things coming up in CT, MR, interventional we do here as well, and obviously fluoroscopy like myself, ultrasound. There's lots of different areas you can go into. With it being a major trauma centre as well, it's really busy, so you will get lots of new skills, develop your own skills, experience new things, so it's really good for your career to come to Preston. I really enjoy it here.
I have seen some stuff here that I've not seen anywhere. So from coming here from other trusts, I've had to develop skills that I didn't even know that I was lacking because they just didn't do those things. But I've picked these things up and I've gone along and it's a challenge, I enjoy it.
There isn't any aspect that I don't love of it, and I know that sounds cliche, but I don't see it like I'm coming to work. People think like a Sunday morning or whatever, oh I've got work tomorrow. I don't ever have that. I just literally love to come and do my job.
I really enjoy it. It's that interaction with patients, because coming in here I now spend a bit more time with my patients as well, getting to learn about them, and you see the same patients coming through and sort of how they've progressed from when you first saw them to now, and the things they've had done and how their imaging's changed, and it's really interesting to see, and all the different pathologies you come against.
Love the people, love the patients, love working even within the wider team, not just within the radiography department. I love it how each department works with each other and we're all focusing on that one patient. It goes with the job and that's what's good about it.